everyone. A really fun day today on the Reinhartz Rundown. We are partially through our COPD series, and we'll be focusing today on figuring out which COPD assessment tool is the most clinically appropriate and also the most practical to implement in your practice. If you haven't yet watched our COPD review on the Hallmark Symptoms, we'll make sure to drop a link below for you. And as we get going here, keep in mind we definitely need to be using spirometry testing to confirm diagnosis of COPD. We know that functional status and symptom management, though, are still really critical to assess COPD management in our patients. Now, historically, there are 5 scoring tools for COPD symptom management. The first is the mMRC, the Modified British Medical Research Council breathlessness score. It's a mouthful. While it rates the cardinal symptom of dyspnea and shortness of breath, we know that COPD symptoms really encompass much more than just shortness of breath, and so this is really not one of my favorites. Number 2 is the Chronic Respiratory Questionnaire, the CRQ, and number 3, St. George's Respiratory Questionnaire. While both of these are really high-quality tools, they're too complex and they lack the practicality we need for regular daily use with our patients. So our first 3 are pretty much out right off the bat. This leaves us with the CCQ and the CAT. The CCQ, or the COPD Control Questionnaire, assesses symptoms, mental status like degree of depression, activities of daily living. That's great, but there is some evidence that the CCQ score doesn't correlate as well to helping us figure out really who is at risk for a disease exacerbation. The COPD assessment test, or the CAT, also assesses this broad range of COPD symptoms: coughing, sputum production, shortness of breath, etc. It also covers activities of daily living, confidence in leaving the home, and COPD impact on sleep habits and energy level. The CAT is easy to administer. It's been validated across clinical practice, which is really great. And in the realm of us trying to prevent hospitalizations, there is also evidence that patients with a CAT score of greater than 15 are more likely to suffer a COPD exacerbation. So if you're looking for something that's easy to administer, that successfully assesses COPD symptoms, the CAT is the quickest to implement, validated, clinically appropriate, responsive to symptom change as disease progresses, and the result can be correlated to exacerbation risk and system utilization, all elements that make this the most practical COPD symptom assessment tool to implement in practice. If you found this video helpful, make sure to hit that subscribe button and stay tuned for our next updates. That's the Reinhartz Rundown.